a bucket. A couple of the parts have already been cut in half, and some of them are still whole. I haven't done anything with them. But when you get a heart, you need to really do all the yellow stuff on the outside is the fat, and it can be little tubes and vessels that stick out. Kevin, would you be kind enough to grab the heart model that's behind you and bring it over here on the counter and just set it right here? Other way around. So it's like in my body, not your. There we go. Perfect. Thank you. You're going to find that there are little openings. We don't see how this heart's got a lot of tubes sticking off there. When these are taken out of the pigs at the slaughterhouse, they're not real careful to keep lots of all the arteries and veins and stuff off there. They use all that stuff and grind it up and make sausage, I guess. I don't know. But anyways, we don't have a lot sticking off of these hearts. So you're going to have to kind of feel around and find little openings, and those will be some of those major vessels going in and out of the heart. So once you've identified some of those openings, at least you know that all the plumbing, all the pipes have to be on the top. So any of the little openings have to be on the top of the heart. And when it comes down to that blunt coat where there's no plumbing, that's the inferior portion. So we've got the base and the A part, kind of the top and the bottom. So we know it has to fit that way in our body. How do you tell the anterior from the posterior? On the anterior surface of the heart, if you look on this model, arteries are red, at least the ones that are systemic arteries. This great thing is the pulmonary artery. It's carrying deoxygenated blood from the right ventricle toward. But notice that that vessel, the pulmonary artery or pulmonary trunk, is anterior. It's way up on the front of the heart. So as you're looking at the heart, front or back, there's going to be one fairly thick-walled tube that is right front, and that's going to be the pulmonary trunk. And it always has to be on the anterior front portion of the heart. There's not going to be anything like that if you turn the heart around the other direction. In fact, if you do turn the heart around the other direction, you may find little slits or openings where things like the vena cava are going to enter into the heart or the pulmonary arteries that are coming back from the lung. But there's one great big pipe up front, so that will be your anterior portion. So you can actually stick your finger in there, and it will go through the pulmonary semilunar valve into the right ventricle, and you can actually feel your finger through the wall of the right ventricle. It's a thinner walled chamber by far. So you're really not going to work with an intact heart very often. You're going to have them cut like this. At least that kind of gives you a feel for bottom and top with all the holes in it. Anterior, it's got the pulmonary trunk, and then that will be on the anterior portion of the heart. All that fat is normal, and it's there primarily as cushioning and helping to make sure the heart gets supported within the body and glides easily within the pericardial sac. It doesn't use energy within that fat really as its energy source. These little brownish things are where the atria are going to be. So there's a right atrium and a left atrium on the heart. So they don't have an awful lot of fat around them, and they're very thin-walled, as you'll see. What I've done with these other two hearts is I've taken a knife and I've cut them and tried to come up with an anterior and a posterior portion. So let's take one of these hearts. We'll do this one. And the reason I'm rubber banding them is so when you take these things apart, you'll be able to put them back together in the right order. So here's a heart. Here's the inferior portion. Here's the superior with all these tubes coming out. Here's a big tube in the front that I've already come into. So there's a pulmonary trunk up there. When I cut the heart, I cut it into an anterior portion and a posterior portion. I'm going to set the anterior portion down for a moment just to orient you as to where the chambers are, and then we can do the pathway of blood flow in a moment. There are two chambers up above, which are very thin-walled. I'm opening up the right atrium, and if I kind of hold that up to the light, there's actually, you can almost kind of see through it. And then all the little ribbing that you see in there are called the pectinate muscles. So I'm opening up the right atrium. The little flap down here represents the tricuspid valve, and it separates it from the lower pumping chamber, which is the right ventricle, a much thicker wall. But look at the wall on this chamber down here. Very thick-walled chamber there, very thick on the interventricular septum. So there's the left ventricle. Once you find that left ventricle, the thickest walled chamber by far, as it would fit in my chest, all the other chambers fall into place, and if you know the pathway of blood flow, that 15-step process, you're going to be able to find everything else you need to know in the heart. So if this is the left ventricle, what's the name of the chamber adjacent to it, side by side?
Right.
Right ventricle. What's the name of the chamber superior to it?
Left atrium.
Left atrium. What's the name of the chamber superior to the opposite chamber?
Right atrium.
Right atrium. So find that left atrium and everything else will fall into place. Let's do the pathway of blood flow now. We always traditionally, again, use the vena cava as the starting point. We don't have a big tube like on our model. Here's a vena cava, the model, and there's one underneath, and they actually sometimes come together, sometimes they enter the chamber at separate points. And on the pig heart, the superior and the inferior vena cavas really can't be differentiated, so we just call it superior vena cava. If I find the right atrium, I know that the vena cava has to feed into that. This opening in the back I just stuck my finger into is where the vena cava would have entered, but most of it got cut off when this heart was taken out of the pig. So there's no tube sticking out of it. So the only way I could really ask on this heart about the vena cava is I might say, name the chamber with the finger in it, and you write right atrium, name the vessel that supplies blood to that chamber, vena cava. So if you know your pathway, you know what feeds into the right atrium. In fact, what a lot of people do on this mixed lab exam, they'll take their answer sheet, flip it over, and quickly just make little abbreviations for that pathway so they know, okay, I've got the path down. And now I can answer questions about the heart, the model, the chart, and the pig hearts with regard to that once you've got that pathway. So practice it, write it out, know it, you'll need it for lecture. You can already anticipate a multiple choice question with steps, and you got to put them together in the right path when I give you the different places. And you're going to have stuff like that in the lab. So it's something that you really need to know by heart. All right. So here we go. Those of you guys with your handouts handy, if you want to use a pen or pencil and write down the exact same numbers that we used in lecture, going 1 through 15. Number 1 would be the vena cava. So on your handout, find the vessels, find the vena cava, and if off to the right of it or whatever, if you want to just put like a little number with a circle around it so you know we're dealing with the pathway, vena cava is number 1. So here's vena cava where it would come in. Everybody's rushing to get their papers and pencils and stuff. So vena cava, number 1. Number 2 would be the first of the 4 chambers, and it's the right atrium. So atrium with the letter R, put a number 2 by it. That's the right atrium. Number 3 is our first valve. It's the tricuspid valve. Between the right atrium and the right ventricle is a membrane. It looks like a membrane with strings attached to it. And I put the probe underneath it. That little flap with the strings that extend inferiorly from it is the tricuspid valve. That valve is really just double membrane, double layered endocardium. It's remarkably thin and yet incredibly resilient. So that's all you get for life unless they surgically replace your valve and put another one in. So that's number 3, the tricuspid. Number 4 is the chamber beneath it, which is the right ventricle. So number 4, right ventricle. When the right ventricle begins to squeeze, engages in systole, flap, it shuts the tricuspid valve, won't let blood go back up into the right atrium, and now we have to go to the front of the heart. The only exit point out of there is going to come out of the right ventricle, and I just stuck my finger up in through the pulmonary trunk, but we go through another valve. Number 5 is going to be the pulmonary semilunar valve, and I cut this tube open to try to show you that. And that little flap right there, there's no strings attached to the semilunar valves. So as you go from the right ventricle into the pulmonary trunk, as you go from number 4, the right ventricle, through number 5, that's one flap or one cusp. There's another one. And that's the pulmonary semilunar valve. Right there. You then go into number 6, which is the pulmonary trunk. And you can put 6 and 7 on the same thing. I think I just have pulmonary trunk / artery on your handout. Is that what I have? What do I have? Pulmonary trunk 6, pulmonary artery 7, because they split. When you come up this pulmonary trunk, this big tube right there, it'll split. And the one goes the left side to the left lung, right one goes to the right lung. So that'd be number 7. Somewhere on your paper, write the number 8 and put lung, just to be consistent with what we did. So you know that number 8's the lung, and I'm not going to ask you that on the exam, but it's nice to know that 8's the lung. So we've taken blood that's returned to the heart from the body, deoxygenated, and shot it out now towards the lungs. Blood's going to come back from the lungs. And number 9 are the pulmonary veins. Pulmonary veins are these red tubes on the heart model on this side and on that side. And on our poor little heart here, we don't really have very good pulmonary veins. They got cut off in the back. Here's the back side of the back portion of the heart. So what I'm going to do is just going to stick my finger in where the pulmonary veins would be, and I popped into the left atrium. So number 9 will be pulmonary veins. Number 10 would be the next chamber, which is the left atrium. So that's the thin-walled chamber that's on the top on the left side, left atrium. Number 11 is another valve that has strings attached. And that valve is the bicuspid or the mitral valve. 8, 9, 10, And that's 11, right? So number 11. So that's the mitral or bicuspid valve, and it's got strings attached. And then the bottom chamber below that is the one with the thickest walls around it. There's the left ventricle, number 12. Once the left ventricle begins to squeeze or contract, it will slap shut the bicuspid or mitral valve. Blood can't go anywhere. Pressure builds up and will pop open, number 13, which is the aortic semilunar valve. And on this heart, we actually have it. Here's the aorta way up high, and this little flap here, I'll pass it all around, that's the aortic semilunar valve. The aorta is the thickest walled vessel we have. Blood's under more pressure there than anywhere else. It's a very thick walled vessel, but yet that aortic semilunar valve is still double layered endocardium, remarkably thin and yet very effective. No strings attached. Semilunars don't have strings. So there's number 13, aortic semilunar valve. The last pipe then is the aorta, and so blood would come up and out that pipe. Number 14 for the aorta, and then 15 on your sheet, you can just write down body. And then blood would circulate around, do its job, and then come back to number 1, and we start all over again. Go back, Jack, do it again. So blood just keeps going around. Those semilunar valves operate kind of like the pocket on my jacket. So if below my belt was the right ventricle, and this was the pulmonary trunk, when the right ventricle squeezes, it flattens those semilunar valves and pushes them against the sides of the wall, so blood flows easily out that way. So the right ventricle squeezes and pushes blood up and out into the pulmonary trunk. When the right ventricle relaxes, that blood's going to try to come back where it came from. It'll hit the pockets of those pulmonary semilunar valves and pop them out, pop them out, pop them out, and that'll stop the blood from going back. And the same thing would occur with the aortic semilunar valve. So when the left ventricle squeezes, it pumps blood past the aortic semilunars, they flatten against the walls of the vessel, blood goes up into the aorta. The left ventricle stops squeezing and relaxes. That blood's going to try to go right back where it came from, and it catches those pockets of the pockets of the aortic semilunar valve, and they slap together and close and prevent blood from going back down in there. Kind of cool. So pathway of blood flow, find that left ventricle, and you're good to go. Let's find some walls now, because we've done the chambers, the vessels, and the valves. All of them are covered in that 12-step pathway. So let's do the walls. The easiest wall to find is going to be the interventricular. It's the wall that separates the left ventricle from the right ventricle. It's thick. It arises from the apex of the heart and separates the ventricles into the two chambers, left and right. So that's an easy one to find. The interatrial septum is a little bit of a booger because it's kind of twisted around behind where a bunch of blood vessels form. So you almost have to stick your finger into the right atrium, into the left atrium, and push them towards each other, and you're going to find an interatrial wall. Now that's difficult to show on an exam. So if I would ask you for that, again, I might point, name this chamber, right atrium, name the wall that separates it from the other upper chamber. Oh, interatrial septum, or something like that. The other two walls, essentially, I'll use the left side as an example here, essentially are going to be the valves. So here's a left atrium, and down here is a left ventricle. Most of the wall that separates the left atrium from the left ventricle is that bicuspid valve. It's like the garage door in the front of a separate garage. There's mostly a valve that opens and closes. So again, I might say, name this chamber, left atrium. What would be the name of the wall that separates it from the lower chamber? And that would be the left AV septum, atrioventricular septum, most of which, however, is going to be that valve. So one wall is really easy to see, two of them are mostly valves, and the third one's kind of indistinguishable, kind of between the two atria in the back. The inner features are really cool. There's only one inner feature in the atrium you have to worry about, and those are the pectinate muscles. So if I open up the right atrium, and you see the rib-like structure lining the wall of the right atrium, those are pectinate muscles. To me, they look like funnel cake. Great, now you'll never eat that again, right? Okay. Those are pectinate muscles. Very, very good.
It is.
And what's funny is you take the heart and actually hold it up to the light when you're stretching out the wall of the atrium, and it's almost kind of see-through. And those little atrium, again, there's no pressure in here. These are receiving chambers. They receive blood back from the body. They just have that little muscular reinforcement and help to pump blood just to shoot it down into the ventricle when they contract and they go through systole. So that's the only inner feature, and they're present on the right atrium and in the left atrium. When you get down to the ventricle, the other three inner features are located there. First features are the strings, the chordae tendineae. These will attach the cuspid valves to the walls of the ventricular chambers. So chordae tendineae. At the base of the chordae tendineae are little round muscles that they're anchored into. and those are the papillary muscles. So the papillary muscles are the little bumps that kind of stick out into the chamber that will have strings arising from them. And lastly, the trabeculae carnii, the muscular network, is located lining the walls of the ventricles, usually easiest seen in the lower portions of the chambers. Trabeculae carnii. No strings attached to them. They kind of look like funnel cake, but they're down deep in the ventricles. So those are the three inner features in the ventricle.
Really
when I look at the chordae tendineae and the papillary muscles, it always makes me think of somebody, a paratrooper. So think of the guy who's wearing the parachute as the papillary muscle. He's got all these strings sticking off of him, like the chordae tendineae, and the parachute's like the valve. So they kind of look like little parachutes hanging in there. Some of you are going, yeah, whatever. But if you look up on the chart there, diagram A, you can kind of see that. So there's papillary muscles that are embedded in the walls of the left and the right ventricle, the chordae tendineae, the strings, and the valves that are opened up, kind of look like the shroud of the parachute. All right, questions on these hearts?
Does a pig heart have the same
Conducting system?
No, when you're a kid, when you're a fetus.
Oh, when you're born?
Yeah, when you're born, you need stimulus to start breathing, and that valve kicks open.
Yeah, I would think the same kind of thing happens for most mammals because mom's doing all the oxygenation through the placenta.
Yeah.
So there's a shunt from the right atrium to the left atrium, a hole, that foramen ovale.
That's
So
what it was
most
called.
mammals, it's called the foramen ovale, foramen hole ovale. And usually within minutes, if not seconds or hours after birth, it closes up and forces blood that comes in the right atrium. And now it's got to go down the right ventricle, be pumped to the lungs, get oxygenated, and then go through the body.
Is that
up until that time? No need to do that.
So, like when you pull a kid out and he's not breathing, he needs stimulus, like tickle the feet or air. Is that when it's kicking open?
Sometimes
when he starts
that
breathing?
stimulus is a reflex that causes them to.
That's what I mean. Is that
even when they get a little swat on the bottom to get kids started?
Yeah, we
that
don't.
takes your. I know you don't do that anymore. I may be.
But
Good.
is that when it's happening?
Yeah, that's
when they start breathing. That thing will close.
Yeah, that stimulus.
Open.
Apparently, right after birth, it happens relatively rapidly. Is that foramen ovale closes off and becomes that fossa ovalis over time. So blood doesn't seep in between the two different upper chambers. Yeah. We do have, if you guys want to look. Oh, another question. Go ahead.
Back on the blood flow.
Blood flow. Yes.
You mentioned the pulmonary arteries first, and that's deoxygenated blood.
Pulmonary arteries carry deoxygenated blood. This is the only time when arteries are deoxygenated and veins are oxygenated is in the pulmonary circuit. So the pulmonary trunk and the pulmonary arteries carry deoxygenated blood away from the heart, and then the pulmonary veins return oxygenated blood to the heart.
So it's flip-flopped.
Flip-flopped in the pulmonary circuit. Only place. The best rule of thumb, arteries always carry blood away, whether oxygenated or not. Veins always return blood to the heart, whether oxygenated or not. Arteries away, both the letter A, I can remember that, and then veins return it. This is a heart we got from a woman who died in a car accident years ago, and it's in formaldehyde. And Dr. Rapay had already cut off the bottom two rings of the heart. And again, what he's doing, he's looking for thickness of the ventricles to determine what you were asking before, whether someone had a heart attack before or not. So the other two rings are in there. This is formaldehyde. This is a little nastier, so if it bothers your nose, just step back a little bit. But some really cool stuff can be seen. First of all, when you look at the heart this direction, here's the left ventricle, here's the right ventricle. You look at the thickness of the wall difference, it's really pretty dramatic. Yeah, that formaldehyde's got a little giddy up to it. So right ventricle, much thinner walled. Left ventricle, very thick, very, very massive. So oftentimes he would measure the diameter, the circumference, all the way around. There should be a uniform thickness of the ventricle if no previous cardiac damage occurred, a cardiac heart attack or anything of that nature. When you open the heart up, I'm going to open up the right side. You can really beautifully see the pectinate muscles where my finger are. I mean, it's just gorgeous. It really looks pretty. To me, it looks like the lining of some of those cathedrals in Europe or England or something, but the stonework on the top. So here's the right atrium. And those are all the pectinate muscles. There's a valve there. Here is the tricuspid valve. I've got the probe under. And little white strings, the chordae tendineae. And then the lower chamber is the right ventricle, and there's a lot of that trabeculae carnii down in the right ventricle, the muscular ridges that you can see. And apparently part of the reason for those muscular ridges on the inside is to help maintain turbulence and flow of blood within the heart, so that it doesn't get a chance to slow down, sit still, and start to coagulate. Some of you guys noticed last week when you did your blood test, you took your pigtails, cut them open, put blood on your slide, and then doodled around a little bit before you came back, and the blood kind of dried up really quickly. You went to mix it with your liquid and you had to stir it a little bit. So if you let it sit there too long, so blood doesn't like to sit there very long. It tends to kind of coagulate. So by having all those ridges, it helps create further turbulence. We'll talk about that more tomorrow and Monday when we start looking at vessels. So incredible architecture in there. And again, some of the bigger pipes and stuff are in there too. So if this is the right side of the heart, if you ever get confused where you are, just stick your finger in, you'll see where you come out. There's a tube I stuck my finger in, and I can feel it right there, and that's in the left ventricle. So that's got to be the aorta that I stuck my finger in. If I go a bit more anterior into this hole, see where that one comes out. Well, that came out in the right ventricle, so I just put it backwards through the pulmonary trunk and into the right ventricle. So you can kind of play that a little bit. Anyways, if you want to see or touch or hold this, you're welcome to. It's kind of interesting to see and say, God, that's real human tissue. It's not as stiff as these are, but the formaldehyde's a bit strong, so don't hold your head over when you look at it. Don't hold it out in front of you or else yeah, someone else will have to drive you home. Yeah. Okay.
Is the senoatrial node